Oh, aho, Hochunk Raja, Wakunjahade, Hingadena. I want to welcome everybody to the Ramsey County COVID Native Community Support Panel. And we are just so proud to be here. And I have my co-host with me tonight, which I'm really stoked to be in the same room virtually with, is Sherry Reimers. And Sherry, I am so happy to have you on, and this is so needed for our community.
Thanks, Robert. And I'm really appreciative of having this opportunity to talk about COVID-19. And, it's really important that we engage and reach our community and get the word out. It's so important, and we already know that the statistics are devastating, and we want to beat that curve.
Yeah, exactly. One of the things we should talk just a few minutes, like how did this come about? This is like your brainchild of of working with Native Roots Radio and how St. Paul Indians in Action have really reached out to us, and this has just been a beautiful thing.
The COVID outreach really isn't my brainchild per se. We were contacted by MDH, Minnesota Department of Health, back in early spring when COVID just started hitting, and MDH knew that this was going to be a devastating illness and that it was going to impact us at a much higher rate, and so they wanted to get ahead of the curve, and they reached out to St. Paul Indians in Action, Metropolitan Urban Indian Directors, Northwest uh, Community up in Bemidji, and ACO in Duluth. And that's how we got started. And then our community has been inundated by resources from the county and both MDH. And so we were uh, Sarah Holly from Ramsey County reached out, and one of the things I knew, we were all doing pamphlets and flyers and social media, but that radio was a really important tool in our community to reach out, and that's where we met up with you.
Yeah, that was exciting. Before we get going on the show, I just want to I want to say this a few times tonight. One of the things is we're giving away $25 gift certificates for people, natives that live in Ramsey County, to Jay Selby's, one of the coolest places I know, and a sponsor of Native Roots Radio. So we want to keep it within the group, within the community, and vegan options, and they do a lot of great stuff too. Like they give out free bowls to people. You can buy a bowl for somebody, and we do that all the time. So they're really plugged in the community and supporting the Native community. So it's exciting to give back to them and also to our community. So what you have to do is you have to give us your name and zip code, and then we'll come back to you and in a day or so, and then get more information, because we don't want you to put your address on, because that's not cool, especially these days. But one thing I want to do too, Sherry, before we get our first guest on here, because I'm so excited with all these guests we're having on tonight.
Mm-hmm.
What I want to do too is I want to talk a little bit about the COVID cases in Ramsey County. And Ramsey County has the second highest COVID-19 infection rate in all of Minnesota.
Mm-hmm.
It's only second to Hennepin County. And Hennepin County has the highest rate. And, we go over that border all the time. So we really, our relatives need to mask up. And I think one of the saddest things that I see is all our elders and people being affected by this. And so this is really, really important to have this discussion tonight. And so Sherry, I just can't wait to get going, because we're really loaded with some really good guests.
Right. And, we know that our community has already been hit hard. And I think, there really isn't a family that hasn't been touched by COVID and serious illness, if not, unfortunate death. And with our community, there is no border, and we're very mobile. We go back and forth across the river, and we go back and forth from our tribal communities. And So it's unfortunate. You know, we've had a lot of loss, and we're going to
Yeah.
continue to see loss for a
Yeah,
few months.
I agree. And that's why, again, it's so important to have what we're doing tonight. I'm wondering if I'm going to bring Anthony on, and I'm wondering if you mind introducing him, Sherry.
Oh, well, I'll give it a good roll.
Yeah.
Welcome, Anthony. Anthony Stately is the CEO of the Native American Community Clinic and doing some really wonderful things over there. And he's been right in the heart of, making sure that our families are informed and getting the latest and greatest on COVID, and making sure that our community is safe, both physically and mentally. Thank you. Good to see you. Bonjour.
Well, thank you as well for that. Those really kind words. It's good to see you, Sherry. I haven't seen you since before the pandemic, and also before you had your own health challenges. So it's lovely to see you, as always. And I can't wait till we can all be in the same room together. That'll be a lovely day, and be having lots of hugging and probably lots of tears and a bunch of other things happening. Hopefully the sharing of some good food for sure. Right. But I want to thank you, Robert, and also the rest of the producers in asking me to be on this talk tonight. I'm going to shut off my notifications here so that you don't hear that annoying little ding. But yes, so I am the CEO of the Native American Community Clinic, and we've been doing some work in the community for a good solid 11 months since this pandemic started. And I can talk a little bit about the work that we've done, talk a little bit about our plan for the work going forward. Vaccine is going to roll out here soon. We're still in the process of developing what our plan looks like for that vaccine, but we are having daily conversations, myself and my leadership at the clinic, about what that's going to look like, and how to do that in a strategic and a thoughtful way, paying attention to the most vulnerable individuals in our community, making sure that we're serving those individuals as quickly and rapidly as possible. So.
Wow, that's awesome. What kind of health, how can we support our community? And how can we, in a good way?
Well, I think that some things that sort of I thought about in terms of like how can we each individually as ourselves help support our community. One of the things we can do is we can encourage people to make good choices, right, and to try our best to follow the guidelines of the state health department, and do our part to keep other people safe. I just got off the phone a little bit ago with my my brother, who we had a brief conversation earlier in the week about. I just moved into a brand new home. I'd show you more of it, but this is the only part that isn't all messy. So you get to, like, I'm still living in boxes and such. But I was so excited to have a new home and so excited to see my brother the other day. And I haven't seen a lot of my family members for well over 11 months. And I said to him, hey, you know what, Christmas Eve, I was thinking about just kind of having like a few of you stop by and sort of like shifts, just for like 15 minutes, just to say hi, and, pass a piece of pie to you through the door or something like that. And, and we discussed it, and we thought like that would be great. But, the more I thought about it over the course of the week, and then also the more I talked with my partner about it, and then also other family members, we thought, well, as awesome as that would be, as lovely as it would be to be able to see family and spend time with one another during this this specific period of time, the holidays, right? None of us really are looking forward to spending that time away from family. I think as Indigenous people, family and community is what defines us and who we think of. When we want to celebrate, we want to be with the people we love, right? So it was really challenging to sort of like have conversations and decide like, maybe that's not probably the best idea. So I just got off the phone with them and said, we're going to probably have to try and find another time to make that happen. But know that I'm thinking about you and your family and all of your children, your grandchildren, and holding them near and dear in my heart. So just doing our part to be able to try to remind each other that, social distancing and masking and staying in isolation when we might think that we might be sick. All of those things are really important for us to do, especially now because we all see in the news that there's a surge going around, not just in our state, but all across the nation, right? So doing things like refraining from traveling, not going home to the reservation. There's all kinds of reasons why that is important. Like, you could the decision to go see grandma, if you even had seen grandma and grandpa for several months, that decision to do that has to be sort of meted out with like, how much risk is there that you might bring COVID to an elder, and that elder who you love near and dear is very near and dear to your heart and important to many other people in your family. What's the risk worth in terms of the potential that you might be able to get that person sick? So following those guidelines is really important. And if you're confused about the guidelines or you have mixed messaging, because we've had a lot of mixed messages all the way from the administration in Washington, D.C. all the way down about how to do this and how to do this well. What I will tell you is that if you have concerns or questions about what's safe and how to do that well, you can contact any one of our nurses at the nurse line at NAC, and we will help you make some good decisions around that. There's also probably a number of other places where you can get that information, like on the Minnesota Department of Health website and like. So I think that's one way we can do it. We can also reach out to people by Facebook, other forms of social media, make phone calls, make some FaceTime calls, those kinds of things. Reach out to our relatives and have conversation with them, especially if they're isolating, they're by themselves. Reach out to them because they're probably lonely, right? And this has been a long, enduring 11 months of struggling with this pandemic. So reaching out and providing emotional support, spiritual support, doesn't cost us anything to pray, right? We can pray for anybody and everybody. And I know a lot about prayer and how powerful prayer is. I landed in the hospital a couple weeks ago, COVID-19, and those were probably some of the most challenging and difficult 8 days I've ever had in my life. Terrified I wasn't going to see my children again, and I never prayed so hard in my life. And I had a lot of people in the community all around, my home community, all around the nation, people that I know and love, praying for me. And so I know that the power of prayer is the most transformative power that exists in the world. So Creator and your ancestors are always right there to help you. So pray to them, and it will help.
Wow. Peony Gigi, thank you so much for those words. Really, what a great way to start out the show, right, Sherry? I mean, wow,
Right on.
Doctor, thank you so much.
And really, really glad you're doing well. And I just couldn't say enough. And the response to your illness, I think it was in the hundreds.
Yeah, for sure. I will tell you that the hardest part of being in the hospital was being away from my children and not the fear of not being able to see them. And then the other part that was really hard was like seeing and hearing the other people in the hospital. I could hear like this woman, like a couple doors down. I could hear her through the vents. She would cry at night. She would cry and she would weep, and it was so hard to hear that. And my first thought was like, was wondering like, does she not have people who love her and care about her? Does she not like, she's missing somebody, or are there people not reaching out to her? And then I heard a man crying one night, and I thought to myself, I'm going to pray for those people as well, that they find peace and they find comfort. So I would take out my smudge bowl and I would say a prayer for them. And, I think that this is a moment in time in history when, it really tests us as Indigenous people. How much are we going to sort of live our values on a daily basis, and how much generosity can we demonstrate to ourselves and the people that we love, and even people we don't even know? Like how do we show up in the world to be good relatives? And this is the test that will help us understand how deep that value exists in us as Indigenous people.
Wow. Wow. What a great way to start the show. Doctor, I want to thank you so much, Peony Gigi, for coming on and really starting the show off in a good way. I just want to say thank you so much for being on. And Sherry, what a great guest to pick, and what a way to start the show. I am going to go to our next guest, and our next guest, Sherry, the doctor is phenomenal. This was crazy way to start this. I mean, I'm getting teary-eyed right now, but our next guest here is going to be Maggie Lorenz. And we know Maggie from a lot of different ways, and we're really excited to have Maggie on tonight. Maggie, welcome tonight. Geez, what a way to start. I'm still kind of, whoa.
Yeah, it was so good to see Dr. Stately on, and and I heard that he had contracted COVID-19. He was in my prayers every day, and I was just so happy to see that he made a great recovery, and I know he had a lot of people praying for him, so it was really good to see him on the show tonight. And it's been hard, not being able to see one another in community, because it's been a long time since I've seen, Dr. Stately and Sherry and even you, Pilot, in person. And so that's been kind of tough, but I'll introduce myself a little bit here. Also, my name is Maggie Lorenz. I work at an organization called Lower Phelan Creek Project. We do environmental conservation work on the east side of St. Paul, and we're developing a project called Walkontepe Center, and that center is going to really focus on providing some protection and care for one of our sacred sites here in the Twin Cities at Bruce Vento Nature Sanctuary called Walkontepe. And that's kind of our focus. We're not a frontline organization working on the front lines with COVID-19. So I just have so much respect and admiration for everybody who's been on the front lines as healthcare workers, working with the homeless community, and doing street outreach. And that's just what a time, right, to be doing that kind of work. And so, but Lower Phelan Creek, some of the things that we've been doing, we try to do a lot of programming about how people can stay healthy right now, and how we can, like Dr. Stately was saying, lean on your traditions and lean on your teachings and your cultural ways to get yourselves through this time, keeping close to your prayers, keeping close to Creator, using those medicines that we were given, some of our sacred medicines. Cedar tea is just one of the best medicines that you can have right now. And so we've been trying to do some programming to help people learn, how to harvest these medicines, how to use them, prepare them. And, back in May, June, our organization, and that was, around the time when George Floyd was murdered by the Minneapolis Police Department, and everybody was in the streets, and we were in the middle of a pandemic, and we were really worried about how people were going to make it through that moment. And so we wanted to do what we could. And so we turned to our traditional medicines, and we put together medicine bundles for the community, and we partnered with, NACD and Powwow Grounds, and made sure that and Little Earth, and tried to distribute as many of those bundles as we could. We ended up making 500 bundles for the community. And I'm really proud to say that we could do that, as a non-frontline organization. But, we've been seeing the spikes and then kind of the decline in cases. And now we're seeing another rise in the cases in Minnesota right now. And my sister is a frontline worker. She's a nursing assistant, and she's actually working at St. Joe's Hospital right now, and her main job is taking care of COVID patients. And so, unfortunately, this past week, my sister was diagnosed with COVID-19, and now my niece and nephew also have COVID. And it's been tough, it's been tough trying to be a good relative, make sure that you reach out to people and check on them and bring them food and bring them medicine. And those are the things that we can do right now. So I just really appreciate you guys putting this together, and Pilot and Sherry for bringing all of us together to talk about this in our community, because this is really needed.
Well, I want to say Pinigigi because I remember when you guys did those baskets for everyone, and I'm telling you, those are the things that really lift up our community. And I want to say Pinigigi, thank you so much, because I know it was you and your crew, Maggie, and that was beautiful to get all those medicines and things that were in there. Thank you so much for stopping in. And do you have a final word? I know you're a huge community member, and I'm so glad you made it tonight.
I have a
And
question.
and Sherry, go ahead.
Yeah. So Maggie, as a mom, you know, with our Native youth, and you know, we're such a social community, particularly in St. Paul and Minneapolis. How are you handling, or how are your kids handling the pandemic? You as a mom, how are you working to keep them safe?
Yeah. Geez, as a parent, it's been really hard. You know, I'm working from home. My husband's working from home. All of our kids are distance learning from home. So they haven't, our kids I have 3 kids in school, and they're all at different different schools, you know, charter school and public schools. So I've been kind of worried about how that would play out as far as policies, and if, you know, we might have to send one kid, because I know that some schools have been doing hybrid learning. Fortunately, I feel really fortunate that that the schools our children attend have stayed distance learning, because I think that's what we need to do right now. And so you know, it's as hard as it is. We've been quarantining and staying away from, you know, visiting with people, and we've been just getting outdoors a lot, going on nature hikes, and you know, my girls have been learning a lot more about the natural world, and we've been, you know, learning about birds and plants and taking the time to get closer to nature. So that's kind of how we've been trying to spend our time as a family and with the kids, and having more game nights. You know, my 6-year-old just really likes playing Jenga and Uno and all those games. So we've been doing more family game nights too, and trying to get them off their devices and out into nature and connecting as a family. So those are the kinds of things we've been trying to do to stay connected and active during COVID.
And Jenga and Una, you're doing it in Dakota, right?
Yeah, we're trying to do as much as we can too in the language. You know, my youngest one, she goes to Bedote Learning Center, and we're trying to, you know, talk about as a family how we can incorporate more language in the house too. We're all here together, so we might as well be doing something. You know, my husband's a speaker, so we're like, okay, well, we're all cooped up in this house together. Maybe we can take this time to learn our language, you know?
That's really great.
Yeah, that is. I just want to say too, wow, Maggie, thank you so much again. Sherry, if you don't have another questions, I just want to say I want many prayers for your family and especially your sister. Thank you so much, Pinigigi, so much for stopping in.
Piramaya, thank you for having me.
Oh, good one. Yeah, wow. I'm telling you, I just got to find Maggie right there. I got to say remove. Now we just removed her. And wow, when you were help us put this show together, Sherry, it's just like some of the things people that we wanted on really resonated with us. And I think our next guest is really going to really help us through some things, I believe. And, you know, his name's Bill Fullerton, and he is he's a mental health clinician at the American Indian Family Center, and we're excited to have him on. And I just want to swoop him on right now and add him to the show. Hey, Pinigigi, how are you? Welcome.
Thank you. Thank you.
Yeah. So, you know, we are talking to our community here in Ramsey County, and I know you see a lot of our relatives. And can you give us any kind of insight of what you're dealing with and how we can help our relatives?
Yeah, thank you. And I think We're still trying to provide mental health services as best we can. We're doing that by telehealth. We're doing it. I'm sitting right here in my office, here in my house, and trying to communicate with people, trying to do therapy with people who are needing it. We're really seeing a lot of people who are depressed and anxious. I'm sure that's no surprise. I mean, anybody who has a tendency in that direction, when you take a general community climate like we have here in the middle of our pandemic, it makes it worse. It makes it harder for them. I think that what we can do is we can continue to watch out for those people that we come into contact with. If you see somebody who seems like they're really down, if it seems like they haven't been out of their house even to go for a walk or to get outside a little bit, check in with them and make sure that they're doing okay. If you hear anybody mention any kind of idea about suicide, or I wish I'd never been born, or I wish I wasn't here, something like that, pay attention to that and try to get them connected with somebody who can help at that point. Those are the kind of things that I think really make a difference. I also think little things like, even right here in my own house, I have 2 teenagers, and one of the things that I tell them is, you know what, when the sun comes up, you need to get up, because there's not that much light right now. and you got to take in all the light that you can. So when, in the morning, you got to get up. You can't sleep till 11 anymore. That's not going to be healthy at this point, because everybody's kind of got a little bit of a tendency, especially at this time of year, it's getting dark. And, if you again have a little bit of a tendency towards feeling sad or feeling depressed, it's a time you really have to be careful, and you really have to take care of yourself. And so little things like that, I think trying to just keep spirits high in your home as much as possible. I know I'm trying to do a few things. Every now and then I'm trying to make my kids breakfast in the morning. Again, help make the morning time is a little bit harder at our house. And so I try to do a little bit to make that a little bit better. As far as our whole family goes, one of the things that we've tried to do is every week we pick a park to go to. And the deal is we're going to hike into the park, and we're going to make our lunch there. And then we're going to come out. And that has actually been a pretty decent activity. My teenagers have not complained about it, which means probably they like it a lot. Yeah. Oh, Robert, I'm having trouble hearing you. I don't know what happened.
That's cool. I have this cup right here. I got to just show it to you. And I was on mute.
Nice.
So I just muted myself. So this cup is handy. But Sherry, do you have any questions or statements for Bill? Because, wow, this is just a great add to the show.
Well, and he hit the nail on the head. I mean, when you talked about suicide ideation, and that's really key to, keeping an eye on our relatives, and, especially when they start pulling away and, saying these things, because it really is a dark time. I mean, we have the vaccines coming out, but we're not through this yet. We're not even close. And, I just wonder if, are we having an uptick in ideation and suicide rates within our communities?
I haven't heard that we're having an uptick in suicide rates, thankfully. I hope that is not going to happen. I think that everything, all the signs are basically pointing to that we are having, especially a lot of teenagers with more depression. And I think that, unfortunately, those are the kids that we're losing. Those are the kids that are, not attending school virtually. Those are the kids who our youth programs are having a really hard time connecting with those kids too. And they're trying to do everything they can to make interesting kinds of things, pumpkin carving contests and stuff like that we can do virtually and things like that. But at the same time, we know that there's people out there that we have been in contact with in the past that we've lost contact with, and that concerns me quite a bit.
Mhm.
And so I'm really hoping that you know, as things you know, change a little bit, hopefully those people will get referred to us. We're actually not getting a whole ton of referrals from schools, which is surprising but again, I think that's because the kids that really need the help are disconnecting from school as well. And so no one knows exactly what the problem is, but they know that they're not connected anymore. We know that we're not, you know, they're not signing into class. They're not answering their phones. They're not answering their emails. Again, it's very concerning. I think we have a lot of soft signs that things are not good. And again, my, you know, just intuition tells me at this point, you know, there's a lot of us that are not doing that well.
Right.
And we're working hard to keep ourselves above board. And so I know that there's a lot of kids out there. I know that there's a lot of adults out in the community that are needing help. And so I hope that as much as possible, they feel comfortable giving us a call. They feel comfortable calling, again, like Dr. Stately at NAC, another great organization that will help people. But again, the Family Center is here to help people. We work for the community. I hope that comes through. I hope that people feel as good as they can about calling us for help.
What is the number at an American Indian Family Center?
The number is 651-793-3803. And probably the best way to get a hold of us right now is on our website. You can contact different people, and you can also see all of the programs that we have. That's at AIFCMN.org.
Thank you. Miigwech.
Wow, that just awesome. Pini Gigi for being on. Bill, thank you so much for coming on. Wow, Sherry, again, another great guest. I'm sounding like a broken record, but I'm really getting notes here from my wife saying it's a great show, and so she's my go-to person. So this is awesome, and we have to give a quick shout out before we get going any further is to Oglema, who's running the whole background here and changing things, and she's a producer, and what a beautiful job that she's been doing. You know, and so this is making our job easy, Sherry. So
she certainly does. Wow. Yeah.
Yeah.
She's pretty awesome.
Speaking of awesome, why don't we bring on our next guest here? And this person here is totally awesome.
Hey, Kelly.
Yeah, Kelly, Director, Department of Indian Work and Interfaith Action of St. Paul. Welcome to tonight's symposium.
Yeah, hi. Anin Buju, Indigenous Cause, Abitabi Gijin Guke. Hi guys, my name's Kelly Miller. I'm the Director for Department of Indian Work and also Vice Chair for St. Paul Indians in Action. Thank you for having me. Department of Indian Work, yeah, so we are a food shelf. We recently opened a COVID-19 resource hotline, which I can share the number with you as well. So if you have any COVID resources, you need testing sites, our call agents will connect you with Indigenous resources. So they'll connect you with AIFC if you need help with, you know, NAC clinics. They're going to give you resources to our Native agencies. Our American Indian Youth Enrichment Program also moved our services online, which our youth program in the summer was great. The after school program, I think is kind of low, but I think that has to do with, you know, zoomed out. I know I'm zoomed out at the end of the day and don't want to get on a Zoom meeting with my kids later on. Our food shelf has seen a huge spike. We started doing delivery as well. We were able to purchase a van finally. So now we can deliver food to families that have COVID or don't want to go out or are homebound with transportation issues. So since COVID started, we have given out over 113,000 pounds of food. And we had 424 new families start coming to our food shelf for food.
Kelly's really been a rock star in the COVID scene. I'm telling you. I mean, she has really innovated the work that they do over at Department of Indian Work.
Yeah, definitely. And just like the hotlines, the phone calls, those things. I mean, I feel like a lot of people in organizations, Sherry, are totally stepping up, and this organization, and Kelly specifically, is really stepped up during these last 11 months. And you can see what's happening by not only the emails, but by the people that are responding. And I'm just like, again, amazed again on how great these guests are, Sherry.
Yeah, so if you guys need, I'll give you the COVID hotline first. So if you ever need any COVID resources, our agents are there on Monday through Friday, 8 a.m. to 8 p.m. Oh, you got that up there. Perfect. And then same for the food shelf. We're open 4 days a week, 20 hours a week, and our food shelf team is amazing. I have to give a shout out to Teresa and all of our food shelf assistants and Vicky. They work so hard. I definitely could not have done any of this without them.
Wow. 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 Sherry.
Well, and Kelly's working really closely with the Minnesota Department of Health too, and really ensuring the messaging out there, and really working hard to reach our community so that they know every aspect, whether it be vaccinations or the signs of COVID, to how to social distance within our family structures. I mean, she is really like taken that to another level and getting that information out to the community.
Yeah, we'll be partnering soon, Robert.
Yeah, well, I appreciate it. Yeah, and we're partnering right now because of your what you're telling to our community, our Ramsey County community, and how they can get help. It's so big because there may be a vaccine, but we're way, way, way away from any kind of normalcy. So, Pinigi for all you do.
Thank you so much for having me on. See you guys later. Miigwech.
Oh, okay, Pinigi. Thank you for coming on.
Good to see you, Kelly.
Bye.
See you. Wow. Again, let's move on here, but that's awesome. Kelly is really shining in the community right now, and it's great to see younger people really stepping up.
Well, and she really, her heart is, it's all about the people, and really making sure that our elders and our young people are really taken care of. And it, like you said, it really shows.
Yeah. Well, let's bring on what I would like to say is my elder, even though he's younger than me, but a community spiritual leader and a teacher at Bedote. Oh, he didn't like that. I'm sorry, Barry, but you're my go-to guy. So I really am glad that you're able to make it on tonight. And I know from Maggie's videos on Facebook that you also are a Scream teacher like I am. So welcome, and talk to us about how it's affecting your family and your community and what's happening, Barry. Welcome.
Oh, hey, wopila chicha. Tatu kila hewaste wahilo la naku aniwa. I'm alive and I'm here and I'm glad to be here. And it's affected us every day. First of all, I'd like to say thanks to Dr. Stately. Dr. Stately and NAC organized a COVID testing at Harding High School for the American Indian community. And my first test was because of Dr. Stately. So hats off to NAC for being on the leading edge of this and reaching out to our community in St. Paul. We tend to get forgotten all the time. And so I really want to say thank you to Dr. Stately, and also that I'm glad you came through the woods there. We were all praying for you. And I'm glad that you're strong and healthy again. Relatives, they talked about this in the 60s. They talked about this in the 70s, and Ake Hekta 1980s. They talked about this. A time was coming like this. All right. So for the last 5 years, we don't want to call home or go visit mom or grandma or auntie. And now we can't. So this is a time that we have to not be afraid, but we have to be smart. And we need to learn the lessons of this COVID time, right? So when we're through this, and we will get through this because that's the only way, reach out to your mom or your dad or your auntie or your uncle or your grandma or grandpa, or call your cousin, call your friend that you had, go visit them, go see them in person. Don't check in on Facebook, because see, now we're saying, oh, I can't go visit. I can't go do this now. Well, we had all that time before. So there's a lot of lessons to learn. Remember, Wash your hands. 20 seconds, wash your hands. So what we would teach the kids at Pedote Learning Center where I work, we'd say, you know, sing the birthday song. Wash the wash the wash the naku wear your mask. You want to cover this whole thing right here, this because we have to protect ourselves. You know, there's no shame in wearing a mask. You know, I'm immunocompromised, and I had to wear a mask to go back to work for 8 months. Everybody looked at me. Boy, I felt all kind of self-conscious, but the doctor said I had to wear a mask. And that was before the mask times came. So remember, wash your hands, wear your mask, think twice. Think twice before you're going to go out there and say, oh, I'm tired of COVID. Oh, I don't care. I don't want to do this. I don't want to do that. Think twice. We have a lot of stories in our cultural backgrounds. Our relatives up north have stories. Our relatives to the east have stories. Okay, Iktomi is always testing us. So remember, don't be fooled. Don't be fooled by what you see. Remember, wash your hands, wear your mask. There's going to come a time when you're going to get a chance to take a shot. I'm going to be getting a shot as soon as I can get that shot. I'm going to get that shot right away. Everyone says, well, they did this to us. They did that to us. You're darn right they did. But here's the thing about that shot, okay? I've had 14 relatives pass away from COVID, 14 of them. And I was only able to attend one service for a relative who died of COVID, you know, and it's hard. It's hard. And the COVID, especially in South Dakota, because South Dakota doesn't have a mask mandate, they're taking away our treasures. They're taking them. The old people, it's taking them. They have all our treasures, our grandmas and grandpas. And so we have to think about the grandmas and grandpas. You know, so the thing about it is if this time here that we're in, okay, it's hard. But you know, you have to boil your shoes for soup hard? No. Is it that you have to, you know, cut up some cottonwood bark and boil it up for soup hard? No. Is it we got to cut burlap sacks for clothes hard? No. Is it so hard that we have to pick corn out of horse manure to feed our starving kids hard? No. See, we're just used to convenience. COVID is a disease that forces things to be inconvenient. And we are so spoiled that I'm going to go to McDonald's today. I'm going to go to Walmart today. I'm going to go to Target today. I want me. And COVID is exposing us. And you have to think of others. And that's hard. Well, it's hard to be an Indian. Why does they say it's hard to be an Indian in all those old time songs? It's hard to be an Indian because you have to think of others first before yourself. And I'm not talking about when you put on Facebook and showing everybody, look at I gave $20 to so and so. Look at me. Look at all the things I did. No, humility. Wowak wala. Have pity, humility. Don't tell the whole world about how great you are. Let Tunkashila see that themselves. Okay. So this is a time and an era where you have to think of others. You have to be smart because you have an obligation. I have an obligation. We have an obligation to be good descendants. But remember, none of that matters if we're bad ancestors. Okay. So we have to leave something behind. And what are they going to, the young ones, the future ones, our relatives were so spoiled. All they had to do was stay at home or cover their mouths. But boy, they complained and ikaba and cry around because they had to wash their hands. Get out of here. It's not hard. Think twice. Think of others. Think of others. So that's what I think of COVID.
Wow, Barry, thank you so much. Sherry, do you have any final thoughts? I think
I
Barry's
have
done it all for
I
me.
have lots of thoughts. I mean, I just what you're doing for the young people, Barry, and speaking the language and teaching them how to care for themselves, because that takes care of our families, and when they take care of themselves, it keeps our elders safe, and a loss of 14 relatives is not good. We think back to the old epidemics that we've had, and, it darn near took out my family, and, my great grandfather lost, 11 siblings, he was the sole survivor, and, here we're seeing it again, where, some families are losing everyone. And so what you're teaching our young people and your family, Barry, I just really appreciate it, Miigwech.
We have to put things on pause, right?
Mm.
My dad died last year, September. September time came, we couldn't have his memorial. It's really hard because that's a big thing for our community, having a memorial.
Mhm.
We have to put it on pause. We
Mhm.
have to adapt. We have to be flexible with this disease, okay? And remember your teachings, guys. They talked about this. Remember your teachings. Remember your teachings and what Dr. Stately said and what Bill Fullerton said. If you're having a hard time, reach out to somebody. Get a hold of somebody. There's no shame in that. I've reached out to, Bill. I used to cry around to Bill all the time. And so we have to talk. There's no shame. Support one another. Somebody's had a hard time. Now call them. But remember, when this is over, go visit your relatives in person. Appreciate them more.
Well, and Barry, and you talk about the masks, and actually it's bringing out our personalities. We're so creative as Native people, and you see people beating them and, putting ribbons on them and, adorning them. And, knowing you and I both have, compromised health and wanting to stay safe first and foremost, I wear that mask as a badge of honor.
Yep. Don't have fear, relatives. Educate yourself. Fear is a state of mind. You just understand it. They tell us what we have to know. Do the best we can. When in doubt, stay home. When in doubt, stay home.
Good words.
Wow, really good words. Peeny Gigi Barry, for all you do for your community, and thank you so much for Peeny Gigi for being on. Wow, Sherry. Wow. What again, I'm really floored by the guests. And I always tell people when we do Native Roots Radio, they go, "Oh, you have a great show." And I go, "It's all the guests." And here's another show tonight. It's all the guests really bringing it to our people.
Well, I think it's really important, keeping it real and talking about, the experiences on the ground, and what everybody's doing to bring our community together. We're such a physical person. We're such a physical community. Face-to-face contact is so important, and now is not the time. But how we reach out to our community to make people feel, feel important and feel connected, and, from Maggie Lorenz, making our medicine bundles, for our relatives, and, Barry teaching our young people, and, Dr. Stately and all the work they're doing for, the clinic, and Bill and mental health. I mean, it's really important.
Now we're getting to the pedal of the metal here. We're getting our elders involved, and we have John, and we are so blessed to have John. I'm going to unmute John right now. And John Pulper, I am so happy that you made it on. I know with technology and new things, we were praying that you would make it on, and I'm so glad you're here, John. Thank you so much for spending time with us tonight.
Right. Yeah. Well, thank you for working my wrinkles out on my computer and the internet and whatnot. We spent about an hour trying to get myself my computer online here. But at any rate, I'm here and I'm pleased to be here. Thank you for putting on this show, Sherry. And
well, I'm kind of wondering how, John, as an elder, and how you are dealing with COVID, and how is it affecting your community and yourself? And I'm wondering if you could tell our people what you're doing, the people that are listening, what you're doing?
Well, the COVID is just another step in the walk of life for me. I think that we are challenged throughout our lifetime, and it seems strange to be called an elder. I don't know. You just keep walking through life, and it's one thing after another. My lifetime has been really starting on a reservation, being raised back in the woods, so to speak, riding 5 miles a day on a bus to go to school. And I don't have time here, of course, to talk about the complexities and the contrasts in the various parts of my life, but it is interesting. Someday, if I get time, and then have an extension on life, I might write a book about it. But it has its ups and downs. But working with the things that I do work with, it does have its touches upon the COVID-19. But what I've chosen to do, I worked for 25 years for the state of Minnesota, and I retired from there in Department of Corrections, and I was the ombudsman for corrections for 8 of those years. And then I started the American Indian Policy Center. And within those years, I went to grad school at Harvard for a master's in public administration. And I worked a while for a congressman, and having been involved at the Capitol with many things having to do with politics, I was involved in politics out in the streets. So having retired from the Policy Center after 21 years, it's just kind of a natural to keep working on things, and that's what I'm doing now. And I'm working with the tribal state training until COVID came along, and kind of took a hiatus from that because, as you all know, we don't have these in-person training sessions anymore. But mostly state and local government, I'm doing training and educating sessions and still being involved. But one of the things that I've really, in the broadest sense possible, is I've tried to create relationships, partnerships, and so forth between state and local governments and the Indian community. And we've been able to do that between SIA and Ramsey County. And we've also got a TST going forth in transforming systems together is what that TST means. And I was on the 7-member committee to put that body together. We appointed 18 members to sit on that committee, so they'll work hand in hand with 8 units of government in Ramsey County: health, corrections, child protection, the sheriff, and so forth, and forming budgets and preparing programs. And they'll have hands-on and shaping government for how it hits the streets, and mostly in St. Paul, and the census plots, census tracts where most of the poverty exists in our communities. And this is where COVID really is hitting disproportionately right now. So that's one thing. And the other thing is the research, another program which I was asked to help select members to that as well. So again, we've had members from our community, Indian community, African American community, the Hmong community, and so forth. We put together that body, and they've been a part of this program you're seeing tonight, and putting the dollars together so that this was able to be launched. So those are the kinds of things that I'm involved with. So it's not actually, I'm not actually involved in service delivery, but I'm involved in creating the kinds of systems that will provide for the services that are being delivered out in the communities. So that was some of the things I've learned over the years. So that I call it reverse engineering. That if we can be involved in the creation of some of these things, that we can actually have more of a say in how things go. Because let's take a look at it. At the high levels of poverty, the homelessness, the unemployment, the poor education outcomes, the issues and the challenges of child protection, the disproportionate rates of Indian children that are being placed out of home, the criminal justice system, where right now virtually half of the inmates in Minnesota are having COVID-19, and the 10% of the prison population are Indian people, and 20% of the women's prison are Indian women. So we're being impacted disproportionately in those institutions. So in the way that the COVID-19 is hitting our communities, it is really a disaster. So we have to be strengthened with those policies and with the dollars that follow to be able to engage appropriately. And it's going to take things like this that you're doing tonight, the power of this, the power of the media and getting words out and keeping us together on this level brings up the other part of it. We're a people who have been together. We've always been together. We've been a people who've gathered in groups, and we've been a collective throughout time, since time immemorial. We've always been in clans. We've always been in groups and villages and so forth. And now we've been asked to stay apart and not group together anymore because of the dangers of this disease. So this medium is really a godsend. It's really important that we convey our words to each other, and some of the words spoken tonight are taken to heart, and they're coming to our homes, and we're having this exchange. This is really important. So thank you for bringing this. I'm sorry. Right, yeah, so we've done really some good things by bringing our partnerships together. SIA in Ramsey County has an effort that's been going on for 5 years. To the county board, and we developed a resolution at SIA and said we wanted a partnership, and we just didn't want a resolution where you'd file it away somewhere. And that resolution has brought actions that SIA and Ramsey County have a viable action phase where we're acting together to bring relief to our community. So we've just recently developed a Ramsey County Indian Child and Family Partnership, where we hope to reduce those numbers of out-of-home placements and bring improvements to the systems. And we hope that in time these things will grow, because in our history, 50 years ago, we used to be in church basements getting handouts. We didn't have any nonprofits. We knew nothing about nonprofits when we came to the urban settings. So this is something that was new to us. And I happened to be here when those things were happening. We didn't have a nonprofit organization then. First thing we had was the old Indian Dance Club at the YMCA. That was one of the first groups we had in St. Paul. And I lived throughout all these, the St. Paul Indian Center, the Red Schoolhouse. Yeah. And we had along the way, we had different efforts, and they came and they went. And now we've kept some good organizations, contemporary organizations now, and they're growing in and of themselves, and they have a good collective sense. American Indian Family Center, India Young, and the kind of things that they're doing, and they're blossoming in and of themselves. So these are the kinds of things that are really strengthening. So how are we doing with COVID? Well, I think we're strong enough to take on what COVID is bringing, and we have the networks and we have the cooperation. So I see good days ahead for us. And
well, I just want to say, Pinigigi, for all the work. There's people commenting about how much you've been doing for the community for a long, long time, and I'm just really thrilled to have an elder like you on the show tonight. Sherry, do you have any last comments before we really say Pinigigi to John?
Well, I just really wanted to touch base quickly, and I really appreciate you being here today, John. And your words are invaluable. Really just priceless to the community. You mentioned research and research COVID-19. It's race equity and community engagement trusted messengers. It's a project put forward by Ramsey County. And I just wanted to make reference to that when John said research, and maybe in a few moments I could touch base on that just a little further. But yeah, John, I mean, really, thank you. Miigwech.
Oh,
Wow. Again, yeah, I want to mention a couple things too before we get going, Sherry, before you bring that up again, is that everyone's listening to the Ramsey County COVID-19 Native Community Support Panel, and this is brought to you by St. Paul Indians in Action, along with many people in Ramsey County and people that you're going to speak about right now.
So, just really quick, St. Paul Indians in Action, John's made reference, and I didn't do a real good job in my introduction. We got right on talking about kind of the history of why we're here today. But St. Paul Indians in Action is pulled together to address, socio-economic conditions in the St. Paul community through systems advocacy, policy development, and community participation. And, we really try to be a catalyst for advocacy, as you heard John saying, and, change is needed to protect the best interests of our Native communities. And this research COVID-19, we were approached because of our tentacles that we have through St. Paul Indians in Action, which is both community membership, community members, but importantly, our agencies, our organizations that service the community. And so when they reached out to St. Paul Indians in Action, it was that we could be looked at as trusted messengers per se, and provide some media services, outreach, and engagement that aids the county in getting these culturally specific or relevant messaging out to our community. So I just wanted to, just touch base on those two things real quick.
Again, I'm on mute, but now we got some young blood coming here, and this person I've known for a long time here and seen her grown into a great leader. Misko, welcome and thank you so much for being on.
Bonjour. I'll just introduce myself really quick. Bonjour and Dinaway Maganiduk, Misko Gimiwan and Dijnakas. Makwando Dame, Waswaganeg Nandunjaba. Hello, my relatives. My name is Misko Gimiwan. I'm 19 years old. I attend Augsburg University. I'm Bear Clan from Lac du Flambeau, Wisconsin. And I'm so glad to be here. Thank you for inviting me on here.
Can I just jump in here real quick? One of the things that was really important in the research project that to us as part of this media campaign was to develop some radio messaging, some PSAs, and Robert, you were really helpful in pulling those together for us, and Misko and Barry's daughter, Barry and Maggie, is also on those commercials.
Yeah, Madison. Yeah, definitely. And she's going to be on it a little later too. So, Misko, what is, you're a St. Paul person right now. We're loaning you to Augsburg, but you're a St. Paul person. How are you dealing with this? I know you're the TikTok queen, so that's one way, but how are you dealing with this, and what does this look like with your community? Because I'll tell you, I miss you. I miss seeing you. I miss seeing you dance. I miss our selfies. How are you dealing with this, Misko?
Honestly, it's a little tough because I go to Augsburg and a lot of colleges turn to online. And so now like all my meetings, all my classes, all my like sessions with my counselors and everything's online, and it's really, really tough, especially as like an Indigenous person, because as you guys said before, a lot of our things are in person, a lot of our things are face to face, and for this to just change to everything online is so different. It's hard to be motivated, it's hard to feel engaged, but I'm trying my best. I'm reaching out and asking other youth for advice, other students who are successful. But yeah, also another thing is like in this COVID times, like I started making a lot more content on the internet, and I think it's just super cool because now like I'm able to be connected with so many different natives across America and spread a positive message. I just want to say one thing, and like I love using my culture and sharing my culture to I don't know, just let people know that we're here. And one thing that I want to say is that when we have to remember our 7 teachings. For me, because I'm Ojibwe and Anishinaabe, I grew up learning Ojibwe ways, and so we also I just want to say, Maingan the wolf, he represents humility, and we have to be humble enough to wear masks even though we don't want to. Makwa the bear, he represents courage. We have to have the courage to, wash our hands, wear our masks, practice safe practices when we go out. Sabe, Bigfoot, he represents honesty. You have to be honest with yourself and with the people you hang out with. If you're feeling symptoms, if you're, experiencing things that you feel like I might have COVID, I might have been with somebody who had COVID, be honest with yourself and be honest with others. Amik, the beaver, represents wisdom. Be wise enough, know to make the right and wrong choices in which community events you're going to. If you're hanging out with friends, if you're hanging out in large groups, be wise enough to make smart decisions. Mikanak turtle represents the truth. Be truthful about social distancing, washing your hands, and wearing your mask. Mashkwede Bajiki, the buffalo, he represents the buffalo represents respect. You must respect other people's health, your own health, the health of your family and your friends. And lastly, Migazi the eagle, he represents love. And you have to love yourself, and you have to love your family members, you have to love your community, like just practice all these safe things. This is something that the 17 teachings is something that I try to live by. And I just want to I try to spread as much of that message across my social medias as much as I can. And yeah.
Wow. Good words. Wow. Go ahead, Sherry. We brought Maddie on too, Madison Hand, who's been doing PSAs too. Go ahead, Sherry.
Well, I just wanted to say, Misko has been such an inspiration, and if it's really hard for our young people sometimes to stay indoors and to social distance, and she's done a fantastic job. If you ever very creative. I've become very familiar with the background there on her TikToks. But and the other thing that I wanted to mention to our young people, usually we're in the height of roundies and we've got our winter powwow that would be coming up, which is a big event for the Twin Cities. And, watching our young people, they're still, honoring their regalia and finding creative ways to inspire, online. So I just wanted to mention that and say, you just do a great job of, really inspiring not just your generation, but all of us.
Thank you so much. I just want to say one more thing. Since we're all online now, I've been trying to teach how to make regalia, teach, I have all these videos being made on how to because for me, I'm a reconnecting native. I'm still learning on who I am, I feel like, and I know there's a lot of other natives out there that are like that. And I don't know, since everything turned on to online, it's been so much easier to reach more people and to like connect with people who are like me and who are, you know, having struggle. And so like I'm just gonna put this out there. Everyone follow me on TikTok, follow me on YouTube. I try to be as respectful to my culture as possible. And you know, I know not to share ceremonial things, but at the same time, like powwows for everybody. Powwows for like all our Native people. And if that's a way that if you're Native and you need to feel connected, I'm willing to share what I know and what I've learned from my community. But yeah, miigwech, that's all I think I have to say.
Well, we'll keep you on a little bit here, and
Mhm.
we're gonna swing it over to Madison. And Madison, how are you dealing with it? And again, Sherry brought up earlier that you and Misko, and we have a couple other people coming up behind you that have been doing voiceover work for us and sending out the message all over Turtle Island and Ramsey County. So thank you so much for being on, and tell us a little bit about how you're dealing with things.
Yeah, so first I would just like to start off by introducing myself. So Hamitakepi, Madison Han Oyati Mithawakin Oglala Nabedawakatua Avichakia Pixto. Naha Manietu Ake Madopa Naku Open World Learning Community Elwa Blah. So my name is Madison Hand. I come from both the Oglala Lakota Nation and Prairie Island Indian community. I am 14 years old and I currently attend Open World Learning Center. And for me personally, dealing with COVID has been kind of hard because, like Sherry was saying earlier, us as Indian people, we're really like social and we like that physical contact and that like face to face, just like seeing everybody face to face. So it's been really hard for me, and especially starting at a new school, making new friends is kind of hard and difficult. But it is also, I feel like, a blessing, and because you know Mother Earth needs a break, and during this time she's been taking a break from everything that's going on. And you know, even though we can't necessarily see each other in person, we can still support each other through, like Misko was saying, like social media platforms, and just checking in on each other and seeing how each other is doing. And if there's anything that anybody needs, like if anyone is starting to feel sick or they don't have the resources or they don't know where to find cedar or like these medicines that they need to get healthy and recover, like reach out to people and try and find people that can help you either find them or get them for you or help you find them. So yeah.
Awesome. Okay, I was on mute again. That's awesome. Misko, we're going to let you go here, but do you have any final words? And then we're going to talk to Madison and bring someone else on. Do you have any final words? And Sherry, what great guests we got here. This has just been amazing. Misko. You're on mute now. Wait a minute. Let me show you the cup.
Oh my gosh, okay. Yeah, Chimigwich, Apijigomigwich, thank you guys so much for having me. You guys are amazing. You guys are my idols. Everyone that's been on, like, I look up to. And I've learned from all of you guys. You know, they always say it takes a community to raise a leader. And so I feel like, you know, you guys have raised so many leaders in this community. So I want to say Miigwech for this opportunity and Miigwech for teaching me so much.
Well, and before you go, Miss, I just want to say, you know, I was talking to Robert before we got started, and I was, you know, I mean, you know, our elders that we had on the show and our professionals, you know, I see them, you know, a lot, and even more so now with social media, with Zoom. But I was really looking forward to this portion, is to hear how our young people are getting by in something that is just so unprecedented. You know, I mean, like graduations, you all didn't have graduation, and you know, there's so many things that you missed, but you're still making memories, you know. And Misko, you're one of those. They went through and didn't get your graduation, you know.
Thank you.
Yeah, thank you so much, Misko. What a great job. You do so much for the community, and I'm just so blessed to have known you all these years and see you grow into a great person that you've become. So really, Pinigigi for being on today.
Inspirational.
Yes, very much so.
Love you guys so much.
Azuoni. Now we're back to you, Madison. So those are great words, what you said about giving the earth a break. You know, I hadn't thought about that in a while. And can you elaborate a little bit on how you feel about that?
Well, I don't know. I guess like, okay, so like throughout this time, obviously people haven't been able to like you can leave your house, but necessarily some people have been choosing to stay at home and not go anywhere. And like all that gas and that diesel that was going into their cars is like stopping and like getting to be less, and it's helping the atmosphere. And people are really just taking in nature as much as they can as well, and like being more connected to nature instead of constantly being on devices, because like there's not really anything else to do, and it's been like beautiful and nice enough to go on a walk lately. So people have been going on walks, and it's just like, honestly, I feel like this is like what the earth needs to heal and to keep on bringing life for us as Dakota people and Ojibwe people. And
Ho-Chunk people.
And Ho-Chunk people, yes. And just like during this time, you don't have to stop being Dakota, because being Dakota isn't, going to powwows and stuff and going to ceremonies. It's just at home. It's picking medicine. It's just who you are, So keep on being Dakota and be a good relative to people who need it. And yeah.
Wow, good words. Sherry, do you have any last things to say to this young warrior? It's just been so fun to see her grow up into this great Native warrior young person. I don't know. I just have we've picked so many great people to be on here, and Maddie, you are awesome. I just want to say that.
Well, I just wanted to, really highlight, what she mentioned, about the earth and the healing that's happening. And, it's really important. And I know that your family, they really, think green and clean, and, rebuilding, down by the river and, up on the bluff. You're so involved in that. And it really, comes through in your words here. And so I really appreciate that. I just hope and wonder, through our young people, how we will continue to transcend that, taking care of the earth.
Exactly. Well, Wopila for having me on here and just giving me the opportunity to speak.
Right on. Make which.
Thank you, Robert.
I'm on mute still. So that was awesome. I'll be calling Maddie more because we have a radio show and, we got to fill time, and she's just an awesome person. But here's another person in the community that I've looked up to and I've seen all over. And I really, it's funny, Sherry, sent out a bunch of emails who to ask to come on here. And this person answered first. And I went, okay, we're going to have a great show. So I want to bring Brooke on. And I hear a little echo, but I want to bring Brooke on. And
should I mute myself?
No, you sound good. I don't know what's going on. So, but I just want to say welcome and really, I'm so happy to see you on.
Bonjour, Robert and Sherry. Wagaga Mijing, Zibi Manidukwe, Indigenous Kaz, Magizi Nadudum, Mikanak Wajin Dunjaba, Brooklyn Flow. I'm from Turtle Mountains. Grew up Eastside St. Paul my whole life. Went to college for a few years, and here I am back trying to do the adult thing now. And so I am the owner and operator of Ninijanis One of Ones. We're a social enterprise for Indigenous children. And I also, as Sherry knows, I'm the weekend youth worker at the shelter at Andayang as well. So.
Well, and you just took on another role in our community as well.
Yes, thanks to you, Sherry. I joined Sherry's SIA team, St. Paul Indians in Action, as the secretary. So thank you so much for nominating me for that position and believing in me.
So how are you, I know you're a young person and you get out and about and you're doing things. How are you dealing with this, and how are you, mentally, emotionally, and spiritually dealing with it?
Man, I could give you a different answer for each one of those things. Mentally, I'm just trying to power through, and physically, I do know that I am a younger person. I don't have kids, so I'm not a youth anymore, and nor am I an elder. And I've always taught that if you're not a youth and if you're not an elder, then you're a helper. You're everything in between. So I do go out and I go to work, right? And it's important that our people who can do that without, being predisposed or having health issues themselves can go out and continue to take care of our community. And I think of like our youth work. My cousin Autumn Dilly is out in the streets, still helping our homeless relatives. And my best friend Hannah Smith drives down from Duluth sometimes to buy her parents groceries because they're in their eldership and it might not be safe for them to go out. So just recognizing that, I am a helper and I do have to still be out and about because it's safer for me to do so than for others in the community. And it's important that our relatively young folks who are active can do that and do that in a safe way. So that's kind of how I've been dealing with some of it, right? Is telling myself that I have a role to the community still. Yeah.
That seems like I got feedback going on here, so I'm going to turn way down. I just got to say too that you are still a young person. I'm just old, so but I really appreciate you being on and doing all the work. Sherry, do you have a question from this young warrior?
Well, I'm just, I'm always curious with our young people. They talk about COVID and COVID-19 and having our young people be, some of the
problem.
Not the problem, but is being
those
impacted at a much higher rate right now as far as being, the spreader. And how do you see the young people your age, the young professionals really caring for themselves and our elders around the community as far as, social distancing?
Yeah, that's been a hard one. I've been sending my friends cards. I tag them all the time in social medias and try to let them know I'm thinking about them. I guess with having this a level of responsibility to take care of others, it's sometimes you lose that side of taking care of ourselves as well. I haven't been able to go to the gym. That's been really hard on me, and a lot of my other friends who use that as their outlet or their therapy in a way per se. So I think it is checking in with each other. I'm really big on gifts. I'm very generous to my friends and taking care of them and sending even gift cards for food or, Anda Young has been very generous to our staff in sending us food, gift cards for food. And I think that we can't share meals right now, but we can remember to honor each other and sending smudge packets, right, to just my friends and smudging before I get on my virtual meetings. It's so weird, right? Like, it's like, how do we come together and do things in a cultural way that we used to before starting meetings? And everything looks a little different right now, but just remembering some of our medicines and to being kind and generous to each other.
Well, and to our young people, I know it's scary for me. And for our young people, it's like, a minute's a day, a day's an hour, or a day's a week, and so forth. So, it just, the confinement that we feel and our emotional health, you know, and how do you, take care of that? And, it sounds like you're doing some really great things, keeping other people inspired.
Yeah, definitely. It's been, emotionally it's been a roller coaster as well for me. I just try and make sure that I keep a strong front because I've also been taught that I'm an Anishinaabe Kwe and I don't get to cry in front of people. I've been doing a lot of crafting and encouraging all my friends who are artists to continue to do that for themselves as well. And even in this time, like I said, if you haven't beaded an emblem of your cousin yet, are they really your cousin? So just again, finding that value in our cultural pieces, in our art, in our beadwork, whatever it is that we do. And then also again, with that generosity, like I always give my stuff to let people know that like, I'm not just buying you something, a candle or something from Bath and Body Works, that I made you something with like my skills and my love and I do beading as therapy as well. So, right, like when I'm having a hard time, I will go sit and bead for like 6 hours and my back will be hurting after that, but then I feel better emotionally in that way because, our culture has always brought us healing, and Barry talked about how this time was coming, right? And our culture has got us through every time like this, and just remembering the old ways. And the contemporary new ways too, right? Like beadwork is not old, but it was introduced to us, and culture adapts sometimes too. And to remember to be adaptive in these times as well. Like smudging for Zoom meetings, right? Like we didn't think we were going to be doing this, and here we are.
Well, Brooke, if Sherry doesn't have anything else, I just want to say Eenie Gigi for being on, and really for all you're doing. People are noticing you all over the state. You're doing great things, and I'm just so happy that you were able to spend some time with us, Sherry.
I just want to say, I just continue to be inspired by our young people, and really I question who the leaders are now, and it's really our young people.
Thank you guys both. This has been an amazing production. I need to get on your level, so I will be in touch with you guys about how you did this. Thank you, Miigwech.
Eenie Gigi, thank you so much. Wow, that was awesome. Well, this is, we have a few minutes, Sherry, and we have some rock stars here. It's called the Henrys. You guys are on, and I am so happy that I can't see all three of you, though. Can we get everybody in the camera? There we go. And I want to say hello. And Laurel, do you want to introduce everybody?
Oh. Okay, so I'll introduce myself. Buju, Laurel, and Indigenous Cause. Gazak Squad Jamaica, Nindundraba, Makwa, Nindudame, and Ashi Ningodaswe, Nimbabunigiz. So hi, I'm Laurel. I'm from Leech Lake, Band of Ojibwe. My clan is Bear, and I'm 16 years old. And my brothers actually want to introduce themselves. So.
Cool. Don't forget, you're my favorite student. You forgot to mention that.
Yeah, that too.
Well, besides me.
Yep, right after me.
Come for that spot. How Mendakiapi, Chante Mawashte Yad Nape, Chiu Zapido.
Let's go over.
Am I not in the camera?
No, not really.
Dakota Ka Ojibwe Koshka Himachado. Santi Red Lake Ka Leech Lake Himataha. Manitu Ake Mazapta. Hello, hello all my relatives. I greet you with a warm-hearted handshake. My name is Robert Henry. I'm a Dakota and Ojibwe boy from Santee, Red Lake, Leech Lake, and other places, and I'm 15 years old.
Hamadakiwapi. Whoops, I kind of messed up. Just act like it didn't happen. Hamadakiwapi. Chante washte yanape chiu zapido. Cheske makiapido damakota ka hakantuwe macha. Bretu sa ka isanti himata. Wanietu ake ma zapta. Hello, my relatives. I greet you all with a warm-hearted handshake. I am a Dakota and Ojibwe. My people come from Santee and Leech Lake, and I'm 15 years old. You're on mute, by the way, Mr. Powell. We can't hear you.
I was just testing you again to see if you could tell. I'm just so happy that you guys came on, and I kind of vetted you out and asked, I think I asked Chashke, what would you do if you saw somebody that wasn't doing the right thing and distance, and the whole thing with COVID when you're out and about? What kind of things can we do?
Informal. He asked you, Chaz.
He's asking you.
Oh, okay. Well, I think that it's really necessary to remind people that that is very necessary, and it's essential that people that people should wear their masks, hand sanitize, practice social distancing, because something else that's a big problem is a lot of people are concerned about their own comfortability, and they're not willing to take safety precautions, and they're not worrying about anyone else's safety.
Wow, really good answer. Laurel, what are you guys doing? How are you guys keeping active? You know, I mean, distance learning has got to be hard, right?
Yeah. So these two, they actually have basketball practice like online, so they do like workouts and stuff with their coach and their team during like Google Meets, right? And then personally, when I first recovered from COVID, like I was working out pretty consistently and everything, and I was doing a really good job with that. But recently, I kind of stopped. Are you okay?
Yeah.
Recently, I kind of stopped and I kind of like broke that habit. So, trying to get these two can't be serious at all ever. But yeah.
Okay, Robert, you're next here. So what are you doing? How are you doing to cope with this? And turn that frown upside down there. You guys got the giggles. There you go. Robert, so what are you doing?
I've been working out with my team, and doing schoolwork, watching TV. I don't know. I've just been in my house, bored.
Has it been hard, you guys? I know for me, being a teacher, it's been really hard to connect. Have you guys been able to connect with your teachers at all? Robert?
Not really. It's harder to do it online than in person. So yeah, not really. Everyone's always on mute.
Mm-hmm.
Yeah.
Or not showing their face in class and things like that.
Yeah.
It's hard. I'll tell you, it's hard for me because I'm used to relationships. I'm used to telling jokes to kids face to face, and I'm not very funny on distance learning. So it's really been painful for me.
I think you're funny on Google Meets.
Yeah, you're pretty.
Okay. Sherry, we got these young people here. Do you have any kind of question to ask these guys now that they've straightened up a little? Laurel, you're doing great, by the way.
Thank you.
Well, I wanted to, ask Laurel in particular. You mentioned you tested positive for COVID. How did that impact you?
Well, actually, all of us in the house tested positive, including our two younger siblings. And I don't know, all of us, we caught it from each other, but like my dad was the one who got it first. And then I think my older sister was the last one. So we had to wait until her 14 days were up until we could really like come out. So we were in quarantine for like a month or something like that.
Mm-hmm.
So it was really like exhausting, I think, because like, I don't know, we can't really go anywhere anyways, but like at least we were able to like go out on walks and like things like that and just get outside and stuff. But when we had COVID, like we couldn't because we needed to take everybody else into consideration.
And can I just what kind of symptoms were the family members experiencing?
My dad had it the worst. He had like pretty much all of the symptoms, and then this one over here, Chaske, he got it. Oh my god, he got it. Chaske, bro. Okay, you guys need to seriously straighten up.
Hold on,
okay. Yeah, Chaske got it second, and my dad, he was quarantining in the basement, and Chaske was the one who was like assisting my dad and bringing things to him. So I think that's why Chaske got it. And then basically after that, it just traveled throughout the rest of the house, and all of us like teenagers and even the babies, we didn't get the symptoms. Like we got some for like maybe a day, but we weren't really affected by it.
Mm-hmm.
Sherry, can I just jump in here real quick? What I'd like to just quickly say, because we're signing off on radio, is that you're listening to Ramsey County COVID-19 Native Community Support Panel here on the Progressive Voice of Minnesota. So let's get back to these guys here. We only got a little bit time left, but I appreciate you coming on. And I know we've had discussions, and I know sometimes when we're young, we get the giggles and we can't stop, but I think it's really serious because we all struggle. And I feel like some teachers give you a lot of work and some teachers don't give you a lot of work. And so how's the balance going with you guys? Robert, can you answer that? How's the balance? I mean, are the teachers really working a balance with your schedule?
Kind of, a little bit, but yeah, just sometimes like the office hours is pretty good, but it would be better in person. Online school's pretty hard.
Is it hard just to like connect with the teacher and the learning, or is it hard to connect with how is it hard, I should say? And Chashki, could you answer that? How is it hard for you to connect with people in distance learning and online?
Well, I think it's a pretty marginal difference on communicating online versus communicating in person. So communicating online is all dependent on like the communicators, both communicators' schedules, let's say. Like, so if you want to talk to a teacher, you could like, let's say in passing time, you could go and ask them a few questions. Whereas in school, communication is very important because you have to set up one-on-one conversations so that you can meet up with your teachers. And yeah, and then it also, there's a factor of whether or not it plays a good part in the teacher's schedule. So
yeah, it's really hard. I just got to say before I hand it over to Sherry with one last thought with you guys, if she has, is that it's been really, really good. Even though, guys, you have gigalitis tonight, it's so good to see you guys. Seriously, all three of you. Laura, I've missed you. You know, you're one of my all-time favorites, and your brother's here. I'm just learning, and I'm meeting them over distance learning, so it's really hard. But Sherry, do you have any last thoughts with the Henrys before we let them go?
Well, I just want to say it's a great honor to meet the Henrys. I know, you know, when it pre-show, I know Mr. Pilot had some really great things to talk about or say about the Henrys. And the other thing I wanted to say is, you know, one of the things that the Creator blessed us with as Native people is humor. And it's always the best to see our people giggle and laugh. And I think our community has some of the best giggles, laughs, and expressions that any other community. It's unsurpassed. So I appreciate it. You know, it's a good day, you know, to laugh and giggle.
This one will get Laurel. Rumpelstiltskin, Laurel.
Stop.
All right. Okay. Cool. So Peeny, you guys for coming on, and then we're gonna wrap the show up. It was really good to see you, and I'm so happy that you're healthy and here. And so, any last words, you guys? Laurel, you're the oldest.
Yeah, actually, I wanted to like just make sure that everybody's like still trying to spread as much awareness as they can for like MMIW and like Black Lives Matter and stuff, because like the world still has a lot of like important problems along with COVID. It kind of seems like, I don't know, it's just hard because we can't do like our Indigenous Peoples Day March. We can't really do protests. And like, if we do them, or when we do, it's like we're putting a lot of people at risk. And I just think that everybody should make sure that they're spreading as much awareness as they can, or however they can, for like all of these people, because like I said, like the world still has a lot of different issues, including COVID.
Wow, really great words. Peeny, you guys, thank you so much for being on. And we'll talk to you soon. We'll see you in homeroom Monday, and hi Juoni, and then we'll see you soon.
Thank you for having us.
Hi Juoni.
Wow. Okay. Good point, Sherry. That humor is the medicine that we need. That's really, really awesome. I want to thank you, and I want to give you an opportunity to close the show before I say goodbye to everyone. And I always tell the students we don't have a word for goodbye, so we have to say see you later or hi Juoni. But I want you to say the last words, and then I just want to give one more little pitch about people signing up for the giveaway for Jay Selby's $25 gift certificate. If you live in Ramsey County, just leave your name and area code and zip code, and we'll get back to you. So this is really, really, I'm so honored to share space with you and all the people that we're on tonight, Sherry.
Well, and I just really want to thank each and every one of our guests tonight, and thank you, Native Roots, for hosting this symposium. My regret is that we didn't have more time. I think we could have gone another hour or two, just in conversation. I feel like we didn't fully fulfill those conversations. Like there was so much more rich context within those with each individual. And so, how to continue to figure out ways to continue this conversation. I know for St. Paul Indians in Action, we're still out there doing some, making some really great connections with MDH and Ramsey County in continuing this work and, being that messenger for our community, working with our organizations and community members. And, it's really important that our community gets the messaging from our community. And, that's, what we're here to do is make sure that we lift each other up and that we're really good stewards for our young people and our elders, and all those in between, and making sure that we stay safe, wear your mask and wash your hands. And I don't speak Dakota, but I hear Barry in the background, and, Maggie and our, medicine that, has been distributed across the community. And, we keep doing those things and lifting each other up. We're going to get through this, And I just also want to draw people to the St. Paul Indians in Action website. We have a whole page dedicated just to COVID. And we have the links to, from federal on down to city, where people can go directly to the COVID pages. And you can get there by going to ciamn.org. And it should draw you right to the COVID page. Otherwise, just click on the COVID page. So I just wanted to say that.
Wow. And thank you so much, Peeny Gigi, Sherry. It's our first time working together, and I feel blessed all these years that we've known each other. And I think
over 40.
Oh, I'm not even that old. How could it be? Hey, so Peeny Gigi for being on, and I just want to give one more.
Thanks for having me.
One more quick shout out. It's Ramsey County's COVID-19 Native Community Support Panel was tonight, and then please leave your name. And if you live in Ramsey County, you get a $25 gift certificate for listeners from Jay Selby's. I want to say hi, Juoni, to everyone, and good night.
Giga Weapon.